Few people probably ever say, "I'd like to go work for an organization that never progresses, stays right where they are, and is resistant to change." The truth is, some of the best places to work and most successful companies are ones who are always looking to stay ahead of the curve, not only following industry best practices, but also finding their own new ways to do things better. That's the kind of organization Midland Health aspires to be, and several of the physicians who practice here are helping to lead that charge.
Culture of ownership from a physician's perspective is really pretty simple. We have to take charge of our own emotions and our own thoughts and how we want to help this hospital change its processes. And once we individually accept how we want to change and take responsibility for that change, then I think it will happen. And the positive attitude that we portray to others within our little communities within the hospital, just it becomes magnetic and it passes on, and everyone else begins to look inside and change as well.
What I think is most important about what's happening now is that the medical staff is being redefined. It's probably not even appropriate to call it the medical staff anymore as much as the medical community. We're just sort of thinking beyond the hospital to the whole community's health, consistent with the hospital's mission to provide for the whole community's health, and expanding the role and the footprint of our physicians in the community. We're laying the groundwork for a lot of important things to come in the future.
Realizing that the professional atmosphere needed to lead meaningful quality improvements could only come from an engaged and progressive culture, a group of Midland physicians began working to improve the culture among the Midland Memorial Hospital medical staff in 2014. Since then, the results have been noticeable and proven through patient satisfaction surveys and quality indicators.
Since the hospital took the culture of ownership seriously within the last 12 to 18 months, the transformation at all levels of the hospital has been tremendous. And you can see it in all departments of the hospital, including people working the floors, to the human resources, all the way to the administration. And the physicians are noticing this transformation and they started to take leadership and charge of that.
We have the HUSH protocol. It's a help us support healing. It's a sleep protocol that allows our patients to actually sleep better at nighttime. The second thing we worked on is a catheter-associated UTI improvement project where we decrease the incidence of catheter infections in the ICU. The third thing that we worked on is early mobility program in the ICU. And essentially what that is it helps our patients get stronger faster, even though they're on the mechanical ventilator, which is an entirely different way of doing things compared to what we were doing even 2 years ago. All of these programs are multidisciplinary, meaning it's either physician-driven, it's either nursing-driven, but the implementation is always it's a team effort.
Looking back on the progress made over the past year, physicians and administrators at Midland Health are now looking forward, planning for the new journey ahead to not only further improve the system of healthcare in Midland in 2016, but also improve the health of the community as a whole.
We've been repeatedly mentioning a culture of ownership, kind of that mindset of like transparency, collaborative work. I don't think there's any way that we're going to get to where we need to get to when the challenges with healthcare delivery today without working together in a multidisciplinary team to meet those accomplishments. When you see what can happen with a team as opposed to any individual by themselves, it's remarkable. There's just so many ancillary pieces to this, and we can't work in a siloed. We have to be working all together, and that's culture of ownership is more and more taking hold, and more physicians recognizing that their leadership is both necessary but also participatory in the multidisciplinary teams. It's the only way we're going to be successful going forward.